Hi, good morning everyone. My name is Cheryl. I'm a nurse practitioner in movement disorders neurology, and this is your Parkinson's Partner channel where we talk about symptoms and different concerns in between your neurology visits for patients with Parkinson's disease. I wanted this video to be a little bit more casual, hence I am in my daily setup for the day. I'm just making tea and we can sit down and talk about RLS. A little disclaimer that my videos, my content is not supposed to replace the medical advice of your practitioner, so they're meant for educational purposes. Please reach out to your doctor if you have any further questions. You can also talk about what we've discussed in our channel, but for a specific case, we shouldn't discuss that here. That's just a picture of my family. Okay, so restless leg syndrome, in the past we've connected to possible imbalance in the hormones, in the chemicals in the brain, including dopamine. So in the past, this was treated with dopamine medications. So what is really restless leg syndrome? When you have those sensations, they are very uncomfortable. They're usually described by individuals as crawling sensations or pain or vague discomfort to should be both legs. Maybe one is worse than other, but usually they're both legs, and they can go up all the way to the knees or the thighs, and they occur when you're mainly trying to rest. So a lot of the restless leg syndrome, they occur first at night when we're trying to rest, and you find that you have to just move the legs because you feel something on the legs. So you keep moving the legs until the sensations stop. A lot of times people would end up getting up to walk around, and actually the act of walking improves the symptoms. Hence it's really restless, like you feel that your legs are restless because you feel a sensation that can't be shaken unless you do something about it, unless you move around or unless you kick your legs. The restless leg syndrome is also associated with another movement at night, sleep movement disorder, which is called periodic limb movement. And they're actually, while you're sleeping, the legs move. Restless legs is a little bit more, it occurs more when you're awake and trying to rest. So your legs are feeling very restless. The other one that I've just mentioned is when you're asleep. Anyway, restless leg syndrome is not always in the setting of Parkinson's disease. They can occur without Parkinson's, but so a lot of individuals in the clinic ask if they worry that they have restless leg syndrome and then they will have Parkinson's disease. It's not the case. So it doesn't mean that you have restless leg and then you'll have Parkinson's. I'm sorry, I realized that my video cut off, and I just wanted to tell you the other factors that can predispose you to RLS. So those are usually sleep apnea, smoking, alcohol, caffeine, certain antidepressants, and definitely low ferritin or low iron level. It can also run in your family, so that's usually, if it runs in your family, they're very debilitating a lot of times, and the treatment could be long and arduous. How do we treat it? If we wanted to do, of course, every time this is getting worse or newer, you have to bring this up to your doctor, because we have to check, or your doctors have to check your ferritin level, your iron levels, certain vitamin levels. We sometimes check because replacement of those vitamins can sometimes help. But mainly ferritin, and then make sure that we screen for those factors that I've mentioned a while ago to see if you have those that can exacerbate the sensation. If your ferritin is low, then we just supplement you with iron, and usually the restless legs go away, which is very, very good. If that's the case, then it's very easy to fix. Now we just have to find out why you're losing iron, or why you're not absorbing iron from your food. The next is that there are supplements that can help. So magnesium is very good for it. There's actually over-the-counter products that people sometimes, it's like a topical, apply on the legs, which contain magnesium, and they according to them, they help very much. Vitamins such as vitamin B6, vitamin C, vitamin E, I believe, have been looked into in clinical trials. They were deemed helpful. Just be careful with those vitamin supplementation. We have to make sure that they are not actually higher in your levels already, especially vitamin B6, because when you take a lot of vitamin B6, although you urinate them out, so when you drink water you'll excrete them, but when you have a lot of them, sometimes they can cause neuropathy. Exercise and massage before bedtime. Massage before bedtime usually helps. Exercise is mostly in the daytime. Some people will have restless leg syndrome in the daytime too, like when they're napping or when they're going on long trips, like driving or in the plane. So stretching your legs actually help the calf muscles. You can like flex and extend your ankles, and they usually help. There are devices now that are available to provide massage or compression to the calf muscles that sometimes help. I don't know if they would be available in all areas, but they're basic compression devices that kind of mimics the movement, so you don't feel the symptoms. So those are the ones that we've had experienced as far as restless leg syndrome. But really, if those things that I've mentioned, the non-prescription medication ways, are not helpful, then the doctors or your providers will usually start you on medications. In the past, we've used medications for Parkinson's to treat this, but we now know that they can cause augmentation or worsening of the symptoms after several months. So we don't want that. But they're very effective usually if you want an immediate response. But the first line of treatment now are in the line of gabapentin and Lyrica. So those are anti-seizure medications. So those are things that I have for you today, and hopefully they help. If you have any questions, you're free to leave a comment, and I hope to provide more casual videos like this. I think it's very helpful to just sit and chat, and until the next video. Bye bye.